Okay, so continuing on with our discussion about the muscles in the hip and pelvis that also encompass the knee as well. So the semitendinosus muscle, which is part of our, doing two big important points with this, the semitendinosus is a part of the hamstring muscle group, and it's also another two-joint muscle. And the functions that it performs flexion of the knee and extension of the hip. So again, it's important to know when the muscle produces the same joint action at both joints and when it performs different. In the case of this, much like the rectus femoris, now it's the opposite of the rectus femoris as far as what it does at the individual joints, but it produces flexion at one and extension at the other. It's opposite of what the rectus femoris. If you remember, we said the rectus femoris, which is part of the quadriceps group and is on the anterior portion of the thigh, it does flexion of the hip and extension at the knee. The semitendinosus, which is two-joint muscle, it's now on the posterior surface, is going to produce flexion at the knee and extension at the hip. It is also part of the pes anserine muscle group. Okay, it inserts on the anterior medial surface of the tibia. Again, this is a posterior view. You notice again in these illustrations when they're showing the insertion or the origin from the opposite side, they do the little dotted line instead of it being a solid line. So it is on the anterior surface. It is part of the pes anserine. So there's three muscles in the pes anserine group. You have the sartorius, the gracilis, and the semitendinosus. Okay, so when you're looking at illustrations of them in your textbook, some of the pictures, you can see how they fall. And that's actually the order going from kind of superior to inferior that they fall as well. You have the sartorius, the gracilis, and then the semitendinosus. So you can see again here, this is part of the hamstring muscle group. It is one of the muscles on the posterior side of the thigh. The origin at the ischial tuberosity and then coming down, and in this case, being a part of the pes anserine muscle group. The semimembranosus, which is also part of the two joint muscles, so it does cross two different joints. It's also part of the hamstring muscle group as well. So the semimembranosus, flexion of the knee, extension at the hip, much like the semitendinosus. The difference here being, it actually is the same origin as you can see. The insertion is different though. It's on the posterior medial surface of the medial tibial condyle. So again, we're seeing the solid line there. If you could look right above the laser pointer, it is a solid line, so it is showing you where the actual insertion is on the posterior surface of the medial tibial condyle. Okay, and then the last muscle in the hamstring muscle group, it's also a two-joint muscle like the other hamstring muscles, is the biceps femoris. Like the other hamstring muscles, it produces flexion at the knee and extension at the hip. Okay, also like the other hamstring muscles, it has a common origin with them at the ischial tuberosity. So all the hamstring muscles originate at the ischial tuberosity. Now, it's the biceps femoris. So much like the biceps brachii, it has two heads, okay? And in this case, the important thing is it's going to have two origin points here. You're going to have obviously the common origin with the rest of the hamstring muscles on the ischial tuberosity. The other origin of the biceps femoris is going to be on the lower half of the linea aspera, okay? And then you come down at the insertion. So now, different from the other two. So the other two hamstring muscles had a medial orientation to their insertion. The biceps femoris is going to have a lateral orientation on the lower legs. You can see here lateral condyle of tibia and the head of the fibula. So unlike the other two hamstring muscles, the semitendinosus, which came around and inserted on the pes anserine, and the semimembranosus, which inserted up here on the posterior medial side of the medial tibial condyle, here you're going with a more lateral orientation. So there you have all of your hamstring muscles. They all produce flexion at the knee. They all produce extension at the hip. They all originate on the ischial tuberosity, and again, you also have the other origin with the biceps femoris, and they're all two joint muscles. Okay, the glute max. Okay, so the glute max, we're back to a single joint muscle. It does extension at the hip. It's actually the most powerful and most efficient hip extensor because it only crosses one joint, responsible for that movement. It is also going to produce some external rotation at the hip. If you kind of look at the orientation here to kind of see that, you can see how the fibers kind of pull this way. So where it inserts on that lateral surface of the greater trochanter and the ilia and the fascia of the iliotibial band, if it pulls from this direction, it's going to create that rotational movement at the hip as well. So primarily, though, it's typically discussed as an extensor of the hip, and it is, again, the most powerful extensor of the hip. Okay, the glute medius. If you remember, we talked about the glute medius as being a hip abductor. Okay, you can see it does also have some rotational components. The anterior portion of the glute medius does do internal rotation, and the posterior aspect of it does do some external rotation. You can see here the origin insertion. Again, here you're looking at a more lateral orientation. So the origin is just the lateral surface of the ilium, and then the posterior middle surfaces of the greater trochanter of the femur. Okay, the glute minimus. So when we were looking at the previous slide, looking at hip abduction and talking about the movements, we mentioned how the glute minimus was there. You couldn't see it. Well, now you can see the glute minimus. So again, it's deep to the glute medius. So that's why, so you have to cut away. So the glute medius would actually be right here. You wouldn't be able to see it if it wasn't cut away. You see that the origin of the glute minimus is slightly lower, a little bit more distal, whereas the glute medius is up around here. So that's where you wouldn't be able to see this as well. The insertion is going to be on the anterior surface of the greater trochanter of the femur, and it's going to, again, produce hip abduction. Okay, the tensor fascia lata. Okay, the tensor fascia lata does abduction of the hip. It also does produce some hip flexion as well, as a secondary movement. So this is kind of an interesting muscle because you have the origin up here. I'll come over to this side on the anterior iliac crest and the surface of the ilium just below the crest, and it inserts down here. So remember we talked about Gerdy's tubercle, okay, on the anterior lateral surface of the tibial condyle. It comes down onto Gerdy's tubercle through this long band called the iliotibial band or the iliotibial tract. So it comes off of this big, long, tendinous structure and inserts down on Gerdy's tubercle, which you can see right here. So remember we said, we're looking at the anterior surface of the knee here. You have Gerdy's tubercle on the lateral portion, on the anterior lateral portion. And then, again, what did we say? I want you to think about this for a minute. What did we say is on the anterior medial side? So remember, we said on the anterior medial side, we said that was the pes anserine, okay? And then think of the three structures. So Gerdy's tubercle is the insertion for the IT band, which the tensor fascia lata comes down off of, and then the pes anserine, which consists of the sartorius, the gracilis, and the semitendinosus muscles. Okay, the deep six lateral rotator muscles. So this is kind of, some people refer to this as the rotator cuff of the hip joint. So these all produce external rotation at the hip, okay? So here we're concerned that you know the names of the 6 deep lateral rotators, even if you don't know the individual origin and insertions of the individual ones. The general insertion you should know, okay? It's going to be on the greater trochanter. So that you should know. The specific origins I'm not as concerned about, but note where they all insert. And again, make sure you should be able to name all of the 6 deep lateral rotators at the hip. Probably the one you'll hear about the most often clinically is the piriformis. And you'll hear about the piriformis because the piriformis is sometimes implicated with individuals that if you've ever heard of the term sciatica, the sciatic nerve runs right past the piriformis, and actually in some people they have an anatomical variant where the sciatic nerve actually pierces the piriformis. So sometimes in individuals who have a tight piriformis, it can cause some symptoms, some nerve symptoms that create some discomfort in those individuals. So that'll probably be the one you hear about the most just clinically from a pathology standpoint. But all of these muscles produce external rotation at the hip. Again, make sure you're familiar with all the names and their common insertion point. Okay, again, going back to, so just to review, our muscles and their primary functions in as far as what they will do as far as motions are concerned. So hip flexion. So I want you to, for just a second here, look at these pictures. Okay, so first of all, right now, hopefully you could recognize, or at some point be able to recognize, just by looking at these pictures, what these individual muscles are. Okay, so, and you should also be able to tell by looking at them whether you're looking at an anterior or posterior picture. Okay, so here are the muscles that do hip flexion. So we have as agonists. Okay, the psoas, the iliacus, so the iliopsoas. So we should know that the iliopsoas consists of 2 muscles known as the psoas and the iliacus. The rectus femoris. Okay, here is the rectus femoris right here. Okay, of your rectus femoris muscle. It's also one of the quadriceps muscles, and it's a 2-joint muscle. The pectineus. Okay, the pectineus you can see here. And then you also have the sartorius and the tensor fasciae latae, which also contribute to hip flexion. Okay, your hip extensors. Again, you should be noticing that you're looking at the posterior side of the hip and the femur. Your agonist, your glute maximus, biceps femoris, semitendinosus, semimembranosus. Okay, so your hamstring muscle groups. Okay, they're going to be your muscles that are going to perform hip extension. Now you notice we say the biceps femoris long head. So why would we say biceps femoris long head? Well, because the short head doesn't cross the hip joint. Only the long head does. Okay, remember the short head originates on the posterior side of the femur, so it never crosses the hip joint. It only crosses the knee joint. Okay, hip abduction. Okay, so again, we look at our agonists. The glute medius, the tensor fasciae latae is also going to be contributing to hip abduction. The glute maximus, because of its line of pull, we didn't mention it necessarily within there, but it is going to produce some weak hip abduction, and then your glute minimus as well. So the glute medius is going to be the strongest of these to do this, but these other muscles will contribute to hip abduction as well. Then your hip adduction, adductor brevis, so your agonist here, your adductor brevis, your adductor longus, adductor magnus, and your gracilis. Okay, are going to be your hip adductors. Again, notice the orientation of all these muscles. They're primarily on the medial side. Okay, so when you're kind of, again, looking at these pictures, reviewing, obviously, again, as I've said before, the text, the illustrations in your text are a lot different, but again, they give you another view of these. So you can look at them separate and also look at them together with the other muscles that are within the different muscle groups. Okay, hip internal rotation. So we didn't talk a ton about hip internal rotation. These are the agonists to hip internal rotation, the glute minimus. The glute medius will participate as well, particularly the anterior fibers of the glute medius will produce internal rotation. The tensor fascia lata will also do that and will also contribute to hip internal rotation as well. And then hip external rotation. Again, your agonist, so the glute maximus will produce hip external rotation along with the 6 deep external rotators. And remember for those, again, note the common insertion at the greater trochanter, and again, be able to recognize more particularly the names of the 6 deep external rotators. So that concludes the hip and pelvis. Again, if you have to go back, review these pictures. If there's anything you missed, you could feel free to review the videos again. Make sure, again, you kind of connect this with when we get into the knee. Obviously, we're going to be talking about similar muscles. We're not going to be introducing many more muscles as far as the knee is concerned. There will be some that we didn't talk about, but we're going to be discussing many of the same muscles that we discussed in this chapter. So again, carry over your function with that. We already mentioned some function at the knee by virtue of what some of these muscles at the hip perform.